Another snowy day in Wisconsin. If you're watching this and it's July, appreciate it, because it's not pretty out there right now. Anyway, regardless of that, I want to talk about some interesting things. Specifically, I want to talk about the difference between symptoms and functional issues. It's interesting to note that as an acupuncturist, one is actually trained in both areas, and I'll explain what I mean. There's a concept known as indications that are looked for. When an acupuncturist studies herbs, or when an acupuncturist studies an individual point, there may be a list of different indications. Now, what's meant by indications would be, for instance, the point might be good for headaches, neck pain, sinus problems, etc., eye issues, what have you. So for example, there may be a point that has a positive effect on that symptom. There's a far more important thing that we study that unfortunately is missed by most acupuncturists, and that is the idea of treating function. And so in addition to a list of indications that may be given for a specific point, there is also a list of functions that go along with that. Now, this is a slightly higher level of understanding, and it involves more change internally. And in the end, it's like the body starts doing what it's supposed to on its own, which is kind of how it's supposed to go in the first place. Wouldn't you agree? I mean, that's kind of what's supposed to happen. So basically, a function would be soothes the liver, calms, stressful circumstances, invigorates circulation, changes circulatory patterns, improves heart function, nourishes the blood. These will all be functional concepts, things that you could do while performing acupuncture from the acupuncturist viewpoint. Now, the reason I say this is an acupuncturist is trained in this symptom kind of indications based area, and then an acupuncturist is also trained in the functional side of things. Acupuncturists, because of the prevalence of Western medicine in this country, tend towards treating the symptoms, and actually do so in China as well, unfortunately. Now, the problem is if the patient and the acupuncturist are both going after a goal of the symptom not being there and feeling better, it doesn't really extend a person's life. And that's really why this medicine was developed in the first place. So a goal that one could have when getting acupuncture is not, I don't want headaches, but it could be, let's just say the headaches were caused by a buildup of fluids that were congesting the sinuses and causing pressure and leading to pain around the eyes. And they call this a headache. I have a sinus headache. All right? It would be far more beneficial for that person's life and their happiness if the organ systems that are in charge of moving fluids throughout the body and metabolizing fluids were working at a really high level, so that the fluids that were stuck here would actually drain, and most typically would go through the urination or the bowel movement. If we got the body functioning to a level where the fluids went where they're supposed to, which is not into the sinuses, now we're looking at a positive outcome that is lasting. So, the next time that you come into the office, I want you to ask us, how is my body functioning today? Rather than saying, I have an ache in my elbow. And just watch us smile. For those of you who are interested in acupuncture and you want to know what the underlying causes of your problems are, I recommend having us take a peek. And there's there's a diagnostic system we use with the pulses that shows us exactly what's causing the problem, so that we can change the function. Anyway, it'd be an honor to be able to help you. Maybe we can't help you, but if we could help you, it'd be an honor, and we would certainly tell you. So feel free to go to the website, call, ask any questions you have. Feel free to email me, curry@milwaukeeacu.com. Thank you very much. Stay warm.